free ER in the UK called Bizarre ER, and it shows everything. I'm about to watch it and react. Huge thanks to Odoo for sponsoring this video. Let's get started. Whoop.
We're heading to Northampton General, where Slack George student Holly Thompson has arrived at A&E.
That's emergency room in the UK.
Completely unable to close her gaping gob.
Oh.
As Holly can't really talk right now, probably best we tell you how she got here.
So in a situation like this, when the jaw is stuck open, some people call this open lock jaw. If you gently open your jaw, there's a very small amount of motion. When you open your jaw past a few inches, the jaw actually has to come down and out. And when that happens, the jaw can actually get stuck on a piece of this bony prominence that's on the skull, and as a result, end up in a situation like this. Because remember, the masseter muscle that sits there keeps everything tight.
Holly was at college, enjoying a particularly riveting lesson of government and politics.
Now I know why her masseter muscle was tight. I get stressed out talking about politics too, or learning about it.
Uninspired by the political ponderings, Holly opened wide for a yawn.
I guess I would yawn too.
Her massive mouth maneuver caused her jaw to dislocate, leaving her unable to close her cake hole.
Yeah, there's a little disc in there that provides padding, and sometimes that disc can almost be dislocated.
Literally speechless, Holly frantically nudged her classmate. Try as she might, she couldn't help Holly shut her mouth, and the pair had no choice but to interrupt the lesson.
A lot of those situations, panic sets in and the musculature gets even tighter, and as a result, it's harder to move the jaw back into place. So what you want to do is try your best to relax, not flex the muscle, and actually move the jaw side to side gently to see if you could rattle it back into its place.
My name is Ajira, I'm one of the doctors. Obviously I can see your mouth stopping open. Okay. Has this happened to you before?
No, it like potato, it goes like that.
Sorry?
She said, ah ha ha ha, ah ha ha ha, ah ha.
See, this is the situation where I go and get a piece of pen. This is a situation where I get a pen and a piece of paper to allow the patient to write so that they don't stress their jaw out further.
By keeping Holly's mouth wedged open with wood, the jaw muscles will get tired, unlock, and allow the doctor to click her laughing gear back into place.
Again, what you're doing is you're trying to fight the pressure of the mandible, the muscles that are on either side of the jaw, and as a result, loosen the jaw down and back into place.
Relax. Close your mouth. That's it. Back down. Finished.
The doctor's digits are safe, and Holly's jaw is back where it should be. And she's even got a souvenir of splints for the mantle.
I always love to see a happy outcome.
Darren had built his daughters a Wendy house. To finish the roof, he'd laid some tar sheets, which he was heating with a blowtorch.
Whenever there's a blowtorch involved and an ER, I get nervous.
But Darren lost his footing, reached out to stop his fall, but instead put his mitt straight into the molten tar.
Oh, the hand is one of the worst places to burn. During a burn, and a burn to this severity, you're gonna get contractures, which means that the skin tightens and forms scar tissue. And when that happens with the hand becomes less functional. That's why in a situation like this, you need a hand specialist for ideal healing, as well as working with an occupational therapist to make sure your fine motor movement doesn't suffer to the capacity that it can after a burn of that magnitude.
Sending him and his red-hot hand spiralling 6 feet towards the ground.
And he fell.
The relief he got from this roofing mishap was when he forced his boiled and blackened bits into the dog's bowl.
Yeah, in a situation like that, you don't want ice, you want room temperature water. Because remember, when you're going from extremes of temperature, going into room temperature water is gonna feel cold in comparison to the heat that you just experienced, but also in comparison to your own body temperature. Remember, core body temperature is around 97, 98 degrees. So when you go into room temperature that's 70 degrees, it's gonna be much cooler.
With the wound unwrapped, the troublesome tar has well and truly attached itself to Darren's palm. But he's lucky. Dunking his hand in the dog's water will have prevented more serious scarring. Removing the tar is tricky. Its consistency causes it to stick tightly to the skin.
I don't know if there's value in removing the tar quickly. Odds are that skin is very damaged and will likely peel off and fall off anyway. And by doing that scraping motion on tissue that hasn't healed yet could potentially cause more damage.
Graham smothers the hand in Flamazine, which will not only treat any infection, but will soften the tar, making it much easier to remove. 24 hours later, and Darren and his sandwich bag are back.
It's throbbing. quite badly. It feels jolly tight now.
That's what the contracture that I was talking about. It makes it very difficult to move the hand.
The overnight soaking in Flamazine has worked. The tar comes off easily. But the blisters have grown and are now ripe for bursting.
What I'm going to do, I have to let the fluid out
Right?
so you'll heal well quickly.
Is that going to hurt?
Always like a Dr. V.
Your other hand is free. Just give me a slap. Okay?
A little humor in healthcare goes a long way, as long as it's appropriate. I've seen doctors miss the mark on that.
With Dr. D off to get the needle, Darren reveals a lifetime of phobia.
Up until the age of 14, I passed out at every single injection.
And you should never be popping these blisters on your own. Please allow a sterile environment and a trained medical professionals to perform a procedure like this, especially on the hand. There's so many small structures that can get infected, resulting in long hospitalizations, needing IV antibiotics. Just don't do it.
And Dr. D is obviously from the school of thought that confronting your phobia is the best way to cure it.
It is, but usually through a process of desensitization where you work your way to confronting the full phobia.
Blisters form to protect the skin underneath. Releasing the serum will stop the discomfort.
The discomfort comes from the pressure that's built up, and releasing some of that pressure will help. But the presence of the blister is there to protect that skin, so allowing it to be there and form healthy tissue underneath is not a bad thing, unless it's getting so big and you need to see medical help.
It's all over, and a relieved Darren has managed to live through his treatment.
Now it's about letting the hand heal, but again, you want to early mobilize it in order to maintain functionality of the fingers. Back to the ER in just a second, but first I want to tell you about Odoo, a business management software with a full suite of integrated apps. It allows you to bring all aspects of managing your business into a single platform. Check it out. They've got apps like an integrated CRM, accounting, sales, inventory management, and even human resources. Maybe you have a company that sells products like I do with my merchandise. Odoo has apps for production planning, scheduling, and even real-time inventory tracking. These tools are essential and all under the same hood. Their interface is super user-friendly and makes it so easy to bounce around between different apps, improving the efficiency of your day-to-day operations, no matter the kind of business you run. The best part, your first app is free for life. From there, you can pick and choose which apps you actually need, which means you don't have to wind up paying for a bunch of products you'll never use. Click the link in the description to get started with a free 14-day trial of Odoo and level up your business. All right, let's get back to the ER.
Along with breaks and abrasions, blood is an all too familiar sight at Northampton General A&E.
Yeah, I don't know if you can be a doctor or a medical professional if you're uncomfortable with the sight of blood.
What they don't see every day, however, is someone who's been bleeding out of their beak for a week.
And that's not just bad because you're losing blood. It's also not good for the digestive system. It could make it really uncomfortable down there in terms of bowel movements.
I suppose it did start on Monday morning when I went into the office.
I wonder if he's on a blood thinner. Patients frequently that are taking blood thinners for a condition like atrial fibrillation, or if they're taking aspirin as a form of secondary heart attack prevention, they have worse clotting, and as a result, they're more likely to have these bleeds that are uncontrolled.
Roger's troubles began with a polyp, a buildup of hard skin on the inside of the nostril. The polyp was removed in a routine procedure, but a few days later, bleeding began.
Why did it take him a week to get seen? Poor guy.
With congealed blood backing up in Roger's nose and throat, Dr. Salvia knows what's coming and kits herself out accordingly.
Are they just gonna cauterize it and burn that little blood vessel that's causing the bleeding?
If, like Carol, you're a little squeamish, you'd be well advised to look away now.
Oh no, oh no!
As the bolster comes away, a nostril full of congealed blood comes with it.
Coagulated blood for the Americans.
And once the nose is hoovered out, Dr. Salvia's next step is to insert creamed packs up the nostrils to prevent further bleeding.
So in certain cases, we do recommend patients to use a nasal spray like Afrin, which is not known to be used for nosebleeds. It's more so for a congested nose. But the way that it works to help aid in congestion for a short period of time, we don't like it for more than 2-3 days, is by constricting the blood vessels in the nose. When they constrict, you have less mucus production. But if you think about it, if you're bleeding and constricting those blood vessels will decrease the bleeding as well. And it's something that we have recommended in the past for patients or even used in the office.
I'm just going to put this, and hopefully this would stop the bleeding, okay?
Oh right, so no need to cauterize anything?
Yeah, no need to cauterize or anything.
Unfortunately for Roger, his throat is filled with more of these blood slugs. There's only one simple way to get them out.
How is he getting those out without gagging?
Time for Carol, and anyone out there watching who's not keen on the sight of blood, to look away again.
Oh, he is gagging. Oh, that's my weakness.
After a quick gargle and a rinse, it's clear the bleeding still hasn't stopped, and Dr. Salvia tries a new approach. Inflatable packs.
Yeah, so this is like the Rhino rocket that we have. But again, just cauterize it. This seems so weird.
Sorry, it's horrible.
Oh, it's not nice.
And you can numb it. There's numbing medication.
It's a whole 3 days before doctors give the go-ahead for the removal of Roger's packs.
The ice is going to constrict the blood vessels on the bridge of the nose, so when the packs come out, there won't be any bleeding, hopefully.
I mean, this is like what they do post-sinus surgery, but I don't know.
If bleeding resumes now, Roger will be straight into surgery.
Ow.
Sorry, you're right.
Yeah, that one's a little more. That's all right, though.
God, what a pleasure it must be getting those things out of your face.
It's a sudden shock to find you can breathe through your nose again. It's wonderful. I'm a very happy chappy.
You never think about how wonderful it is to be able to breathe from your nose. And for me, I never get that joy because too much boxing damage.
An hour later, Roger's out of bed and ready to go home.
First thing you want when you get home, nice cup of tea. I'm really looking forward to that.
I would enjoy a nice cup of tea. Just make sure it's not too hot, otherwise you can get a little warmth and blood vessel dilation.
4-year-old Oliver Simpson has come to A&E with his mum and gran after putting something where he shouldn't.
Oh no, a marble in a nostril?
Put a bit of Lego up there.
Oh, Lego!
And see how big it is.
Yeah, this happens quite often in our pediatric wards, but in most cases, the way that they're removed is just through air pressure. Either closing one nostril and having the child breathe out very strongly from the one where the Lego is stuck, but generally, the child has to be about 3 years old to understand what you're asking of them. If they're younger, generally medical professionals will have a parent close one nostril and the parent blow into the mouth of a child, and then the thing just pops right out.
Hard and green
stressed out kid.
aren't usually a problem, but drawn into the lung, this piece of Lego could be fatal.
That's a concern a lot of parents have, especially when you're doing air expulsions. It hasn't really been documented in the literature that in a competent patient who has reflexes to protect their airway, that little thing goes into the actual lung or bronchus is pretty rare.
Mum Lisa is going to blow hard into Ollie's mouth in the hope that this will blast the bung out of his beak. But things don't go quite to plan.
Open your mouth.
just the snot.
Simpsons swing over to ENT, where specialists Dr. Singh and Dr. Salvia are ready and waiting.
That could mean that it's in the posterior cavity and it's a bit deeper.
We'll use a crocodile.
We call it an alligator forceps. I use that sometimes when a patient has a giant glob of earwax and I can visualize it and I can get the whole piece. It's a really great way to get something out of there. Or if a piece of Q-tip is left in there because they're digging in their ears with Q-tips, which I recommend that you absolutely don't do.
Squeeze hard on it, Teddy.
Don't move. Squeeze hard on Teddy.
So this is where few things need to come into play. Mom needs to do a good job securing the child because it's securing them for their own benefit. Or if the child's really, really upset, sedation is always an option.
To avoid any further tears or trauma, Ollie's put under general anaesthetic before the team get to work extracting his bizarre bogey.
And here they could use a camera.
By sucking out the snot before going in to retrieve the tiny toy intruder.
Oh, they got it out.
It's out now, is it?
I can breathe now. Let's go, Ollie.
Did you feel dizzy or anything prior to fall?
No.
But Jerry Clark didn't even make it to the pub before ending up with this bizarre bend.
Oh, dislocated finger?
He just tripped it on the crossing and then picked him up and his finger was in a very peculiar position.
I would agree, in my medical opinion, that is in fact a peculiar position for a finger.
Sister Brooke administers a bit of pain relief, nitrous oxide, otherwise known as
laughing
gas.
There you go, it's working. All right.
But Jerry's laughter is soon cut short.
Oh, yeah, it
when
is.
Dr. Simon Alzer arrives to click the wonky finger back into place.
This is called a reduction, a closed reduction.
After a local anaesthetic to numb the pain, it's time to put an end to Jerry's bender.
As long as I don't see him doing it.
I'm surprised this isn't an open reduction internal fixation with some hardware.
Joints are nicely in line, so...
Oh, so it wasn't a fracture.
Clear dislocation.
With the x-rays all clear, Dr. Alzer assesses the nerves.
Can you make a fist for me?
Well, it doesn't look like David Hay needs to lose any sleep, but it does show that Jerry's drinking hand is back in action.
Wow, based on the location, to me it looked fractured, but look at that x-ray, it looks great.
Northampton General is no stranger to real-life drama, but this budding panto dame has been upstaged by his unsightly...
Shouldn't make a diagnosis without a full history, without a proper physical exam, but I'm suspecting an olecranon bursitis. This freaks patients out, and when I tell them, like, you could just go home with this, you're fine, they're like, really?
Burly Rufus Stephen was doing his bit for charity by taking part in a fundraising panto. The plan was to enter stage left, perform a forward roll, and present himself and his bloomers to the audience. But Stephen's somersault went a bit squiffy. He careered into a cast member and bashed his arm.
Yeah. It's usually trauma-driven like that, although I have seen episodes of bursitis in that area happen as a result of people leaning on their elbows for long periods of time during work, computers time, etc. You just gotta be careful that it's not an infectious bursitis, but you would know that based on symptoms and history.
What you've got is bursitis. In your elbow, you've got a smaller collection of fluid.
It's a little sac that sits and lubricates the joint there.
And what happens is that when you knock it, it will increase in size with fluid. And the bursitis itself, which you've got, is quite impressive. Normally they'll come up quite slowly.
It's because he has a traumatic bursitis, and there's probably some bleeding happening there and a massive inflammatory response, which could be drained, but not necessarily. Sometimes we just put a little protection in that area and it'll go away and it kind of resolve on its own.
There's no fracture, and the supersized swelling will gradually subside by itself.
I wouldn't do that. I don't like limiting shoulder mobility or elbow mobility because of that, because what ends up happening is you can develop adhesive capsulitis or frozen shoulder. So I actually want to encourage mobility. I just think more about protecting the area so they're not bumping it over and over again.
For a prize of a piece of chewing gum, James's mate bet that he couldn't jump onto the trampoline from the first floor window. With a canvas surface that was good to soft, he mulled over the odds.
No,
and
no,
made a
why?
dash upstairs.
Why? No!
James hit
Did it
the
rip?
target,
Oh!
but
No!
back up in the air much higher than expected.
Oh! Both the radius and ulna, or is that a humerus fracture? Although I'm sure he's not laughing.
Hello, James. What happened?
Oh, I thought this is an adult. The whole time I'm like, oh, did this person get a little bit sauced up with some beer or liquor? It's like a 2-year-old. Okay, he's not a 2-year-old.
Can you wriggle your fingers for me? That's it.
The fact he can wiggle his fingers is good, but the X-ray result...
Oh! That's a humerus. That said no more.
The distal part of the bone is no longer connected to the proximal part of the bone, which is the rest of the bone.
Literally the humeral head just...
So James is rushed into theatre, and safely under a general anaesthetic, the surgeons set about cutting the elbow open.
A lot of blood vessels there, a lot of very serious blood vessels, brachial artery, there's nerves.
Wires will be needed to hold it in place. So out come the power tools.